probably say everything that I just said. I'm not an expert. I just find this interesting. I had the opportunity to go to the NLN conference a few weeks ago and learn some things about what is coming up with NCLEX. So just thought I'd share some resources and information that I have learned for myself. So I'm going to go ahead and go off camera. I'll come back on camera at the end. I'm going to turn that off. Alrighty, I just want to make sure that everybody can hear me okay. If you can unmute yourself and just say hi, that would be great. Or use the chat room, either way. Not hearing anybody. Let me try turning up my volume here. Arif, I see that I'm unmuting you. You may be muted on your side. It looks like you're trying to say hi. That's okay. Not a problem. All right. I'm just gonna keep on rolling. Hopefully everybody is good. You can use the chat room. Trying to find the chat. Let me open up the chat. You can type a message here. I'm going to go ahead and do that. Hi, everyone. You can type messages here during the presentation. You can unmute yourself. Okay. So I will keep the chat open on my side as well so that I can keep monitoring that. And we're going to keep on going. All right. So NCLEX, next generation. So the objectives for this webinar, we're going to talk about the current state of NCLEX. We're going to talk about what is coming up, what they're calling the next generation NCLEX. We'll talk about the clinical judgment research and model. We'll look at some question prototypes, and then we will discuss. We will see what questions you have out there. So that is what we plan on covering over the next little bit. So this is really the current state, and then the attempt to align it to clinical judgment skills. So this almost all of this information is coming directly from NCSBN. I put the website in the bottom corner. I'm also going to be referencing some of their resources toward the end of this webinar as well. So you're familiar with this. The item formats, they have multiple choice, multiple response, they have drag and drops, hotspot, audio questions, graphics questions, and then exhibit questions. And then on the other side, they have what they identify as the necessary clinical judgment skills that a novice nurse should know. So that would be cue recognition, hypothesis generation, communication, understanding consequences and risks, task complexity, time pressure, and then distractions and interruptions. So NCSBN mapped these things. So they took their item types, their question types, and then mapped it to the clinical judgment domain. So this is current state. So anywhere that you see is green means that there is alignment. So for instance, the audio question type aligns with cue recognition, or multiple response aligns with consequences and risk. Where you see yellow is where there isn't as much alignment, and then where you see red, there's no alignment at all. As you can see from the current state, there's a lot of red on this table. So that, of course, sparked conversations. And, you know, the NCSBN, their researchers, that they identified, you know, the importance of clinical judgment and why it's important. They said it's a necessary skill for the novice nurse, that improving clinical judgment skills can improve client care and lower nurse error. Also having the need for a direct, extensive, and explicit assessment of this construct is very important. And tying the assessment of clinical judgment, it's a critical component to the overall goals of NCLEX, to make sure that there is a minimum competency among novice nurses. And also clinical judgment, really being, as you saw in that graph, and I'll move backwards, it's really being indirectly tested in a very limited manner. So being able to move novice nurses and really getting to that clinical judgment caused NCSBN to realize, you know what, we need to update our question types. We need to make sure that there's increase in alignment. So that led to, and this is coming from ATI, this particular, these 8 steps, but it was a really helpful resource in understanding, okay, what is NCSBN doing? So they started by developing a clinical judgment model, which we're going to go into deeper in just a few minutes. From this, they created a model that has 5 levels of interacting layers to go through and illustrate the complex process of clinical judgment, and also to tie in context, because that's where decisions are made. Context is important and applicable. Then the next step they took was creating item prototypes. So they are looking at their questions, their different types of questions, their scoring methodologies, and then trying to create test items that would better align and be able to assess clinical judgment. This then led to test item usability. So they asked students, nurses, and educators to review these item prototypes that they had created to make sure there was alignment with real life scenarios that a nurse would be interacting with and encountering in their practice. NCSBN then added a special research section to the more recent NCLEX tests. So these are voluntary items that a student, upon completion of their NCLEX test, they can volunteer to answer these questions. Their responses don't impact their scores. It just simply helps this research team see the validity and the question fidelity. So from there, the NCSBN psychometricians were able to look at thousands of results from that special section and analyze to see what item types were accurately measuring that clinical judgment, those clinical judgment skills, and that nursing competence. So right now in 2019 is where the group is moving towards being able to build the technology to support those question types, so that when a student is taking the test, the technology actually works. So building and using more complex technology. We're going to look at some examples of what this might end up looking like as well. So then the next step beyond that is making sure that they're assessing the test questions again, scrutinizing each item type, and making sure that the technology is supporting it and the questions themselves and the answer choices are of the highest accuracy. So all of this is leading up to phasing in this new version, or this next generation, that we will start seeing in 2022 and 2023. So that is the order of operations that NCSBN is following. You're probably familiar with the name Dickinson. I learned all about him at the NLN conference. So he is leading the way on this, and he's leading the way, he and his team. They define what is clinical judgment. So they define it as an observed outcome of critical thinking and decision making. It is an iterative process that uses nursing knowledge to observe and access presenting situations, identify a prioritized client concern, and generate the best possible evidence-based solutions in order to deliver safe client care. I've included the attribution down here, as well as the link to the article. I will be sharing this through the Faculty Development Center so that you will have access not only to this recording, but also to this PowerPoint slide deck, and then you can come and you can get direct access to that article. It's a really good article. I highly encourage you to read it if you haven't read it already. The words here that I really want to highlight are iterative. It's an iterative process, and we're going to look at this model deeper. Okay, so this is the clinical judgment model that they came up with. Now, we use different clinical judgment models here in our nursing program. One name that I'm familiar with is Lassiter. So we use versions of a clinical judgment model And you'll notice that there are definitely similarities across what we use and in comparison to this NCSBN clinical judgment model. So there are multiple layers here. So really, this is all about the doing part of critical thinking and decision making in a number of steps. So notice here we have form hypothesis, refine hypothesis, and evaluation. Well, first we're starting with, okay, what do our clients need? And we're drilling down. Okay, so layer one down here into layer two, starting with forming a hypothesis. This is going to include recognizing cues, analyzing the cues, and pay particular attention. As I said, it's an iterative process. Notice these arrows are going around and around and around. You're constantly refining by recognizing the cues, analyzing the cues, and refining your hypothesis, moving over here to then, okay, you're going to prioritize and generate solutions. So you're constantly drilling down using this iterative process. Then moving over to evaluation. Okay, am I ready to take action? When I take action, what are those outcomes? Evaluate those outcomes. Are they working? Are they not working? Okay, if they're not working, let's go back around and let's look at another action that we might take that would improve those outcomes. So that's what they mean by it's iterative. Okay. Let's drill down even more. Hold on, going back. Sorry. Okay, so again, so now layers 2 into 3. So back into getting closer down in here. So what does it mean to recognize cues? This is where the nurse would be filtering information from different sources. The signs, the symptoms, the medical history, the patient history. They're going to then analyze the cues. They're organizing and linking what they have recognized as cues from the previous step, and they're linking that to the client's clinical presentation. This will then move them over to refining their hypothesis, where they're prioritizing. So they're going to evaluate and rank their hypotheses according to priority. So considering urgency, likelihood, risk, difficulty, and time. This helps them generate those solutions by identifying the expected outcomes and using those hypotheses that they have prioritized to define a set of interventions that might lead to an expected outcome. That then takes them over here to evaluation, where they might take action. This is where they're going to implement a solution or solutions that addresses their highest priorities. So it's really important to recognize that sometimes that no action can be an action in itself. But then they're going to start to evaluate those outcomes. They're comparing the observed outcomes against what they expected as their outcomes. So it's constantly going down, constantly getting filtered using that iterative process. We move down to the next layer. And this is where context becomes so important. So depending on where you are, and actually let me lead back out to the larger model because it'll be easier to see. So it's all funneling down here. So you're looking at your different, you're starting with your knowledge, your specialty area, your experiences. You're moving over, you're applying, any characteristics. So all of this down in layer 4 is also being considered, and all leading to an action and an outcome. So that is the clinical judgment model that NCSBN is trying to align its question types with. Okay, so now let's look at some question types, which I found to be very interesting and a little more interactive for the student taking the NCLEX test. So here's an example of a hotspot example. Their directions are click to highlight the findings that require follow-up. So they're given a case study, they're given the nurse's notes, and then they are prompted to use the highlighting feature to then indicate, okay, what should I be following up on? What would require follow-up? So they actually have to interact with the question itself. So that's an example of a hotspot. Another question example is close, the close example. So it's completing sentences, and they're given a drop-down list of options. So in the test itself, they would read the sentence, the nurse should recognize that the fetal heart rate, FHR, may, and then they would click on the blue box and they would be given a list of options from which that they would select. And they would have to do that for each of the boxes within the paragraph or within the sentence that they are given. So they have to not only consider the information, but then they have to consider the options and choose the best option. And then they're interacting with the question itself. Another example, so we have a couple of drag and drop examples. So they're given a scenario of a client with a temperature. They're given the nurse notes. They're given other information that they have to filter through. They have to consider all of this. And again, have to consider their context. Then they're given the instructions to drag the words from the word choices. They're given a word bank here. And they have to grab what they think is the best answer and drag it into where it should be filled in into the sentence that is given to them with the missing blanks. So again, they're interacting with the question. They have to consider all the information and then choose what they think is the best. Another example of a drag and drop is putting things into appropriate steps. So they're given the example, so they're dragging the potential steps for a nurse to take intrauterine resuscitation. So they're given on the left-hand side the potential steps, and then they have to drag and drop what they think are then the appropriate steps and put them in order. Another example is a multiple response. So again, they're considering the intrauterine resuscitation. They're given the findings on the left-hand side, and then they have to click to specify whether the finding indicates the intervention was effective, ineffective, or unrelated. So they have to go through each one, consider each one, and then interact with the question and select what they think is the best answer. And then finally, we have a rich media example. So they will be provided with pictures, with videos, and they're given the scenario. So in this case, they're given a scene. The nurse enters the room of a client who is scheduled for right total hip replacement in 2.5 hours. Within the picture, they have a number of things that they can click on. You might not be able to see, but so for instance, the IV bag has a blue highlighted line around it. So, and with the number 42. They have the water pitcher and glass. They have food is highlighted. Over here on the monitor is highlighted. So they have to look at this, consider the scenario, consider their cues, and then say which finding in the diagram should the nurse follow up. Click on the finding. So knowing all this, knowing that the patient is going in for a right total hip replacement in 2.5 hours, what is their immediate concern and what should their immediate follow-up be? So they're going to be interacting with media. Let's go back to this table. Current. Again, the green is where there's alignment, yellow is where there's some alignment, and red is where there's no alignment at all. So with the work of NCSBN and using these updated question types and aligning to the clinical judgment model, they now have a new chart or a new table that looks like this. So they're using the enhanced hotspots, multiple responses, all the things that we just looked at a few examples of. And you'll notice up at the top, you have those clinical judgment skills that they're trying to align to. So cue recognition is all green. Hypothesis generation looks like they still have a little bit of work to do, but more green and yellow than there is red. And then you can see the rest of the table. So they are more strongly aligning with those clinical skills. Pretty exciting. Okay. So the resources that I pulled this from, and again, I'm going to provide this PowerPoint in the Faculty Development Center. The NGN information on the NCSBN website is fantastic. If you really want to geek out over this, you can. So if you come to the website, which I provided, they have a whole tab for the Next Generation project. The FAQs I found were really, really good, especially the ones for educators. And they also have some resources built in there. So it'll give you an overview and then give you all these examples that you can take a look at. so that you can better understand these changes that are coming. Also, this webinar that ATI put out, as you know, we use ATI with our BSN students to help prepare them for NCLEX. This was a really good webinar by I believe it was the president of ATI, and then Dickinson was actually interviewed as well. Really, really good information that I found. So I highly encourage you to check out at least those resources, if not beyond. I'm sure you can find so many things out there. I found a lot of other nurse educators on YouTube talking about these changes, how they think it might impact their students, how they are preparing for it at different schools. So you might want to just, after you look at these two resources, you may want to just go out onto YouTube and see what other people are talking about. And that's also a great way of networking with other nurse educators as well, and other programs. So that's everything. I'm going to go to this slide and see what questions or comments do you guys have. And I'm going to come back on camera so you can see me. Hey again. So what questions do you guys have or comments? And you can always type it in the chat box too if you'd like. I found the new questions really interesting. My instructional designer brain was going off like, oh, that's really cool. It's more engaging. It's definitely more interactive. It really gets the students to think and really have to apply those skills. So thinking, from a backwards design, we want them to be successful on this test. Moving backwards, what does that look like for our curriculum? What does that look like, in our classes where the rubber meets the road? So how can we best prepare our students for that? So we need to start considering what that looks like in our own testing environment, using ExamSoft and our practice tests, anything like that. Yeah. Anybody out there? Like I said, I'm not an expert on this. I am learning because I find it really, really interesting, obviously because it has a direct impact on our own program. It may, down the road, have a direct impact on my role as, part of my role as instructional designer, as we want to build up more interactive activities within our classes for our students' learning. It's really interesting. There are a lot of really great resources out there. So.
Hey, Julie, this is Brian. There are a couple typed in questions.
If nobody has any questions, that's perfectly fine. I did record this. I will let you all know when this is live on the Faculty Development Center in Blackboard. Like I said, I'll provide PowerPoint, and you can access the PowerPoint and get to those resources that I included in there for your future reference. And if you have any questions or just want to talk about this, let me know. I'm always available. I'm going to go ahead and end, and I appreciate that you all joined me for this very quick webinar. All right, take care.
Can you hear me? I guess not.